Cancer to Health Bit podcast interviews with our local health experts, hosted by Warren County Public Health. I'm your host, Drew Crawford, public health educator here with Warren County Public Health. And today we're excited to speak with Vicki Yatta and Mary Beth Fisher of the Cancer Services Program and one of our oncology nurses in the Glens Falls Hospital. As we're cutting today, we're going to talk about cervical cancer. It's something that we honestly don't talk an awful lot about. It's not something that's awfully prevalent in our community. There's a lot of reasons why. And today we're going to kind of talk about those reasons. And even though that it may not be as prevalent, it's still important to make sure you're on top of it, make sure that nothing is developing. So before we begin, thank you guys so much for coming on. Thank you guys for being on here and taking time out of your day. I know Christmas just finished up. We're getting into the New Year's. It's holiday season. It's getting a little busy, but if you guys wouldn't mind just kind of introducing yourself, maybe you got some fun facts about yourself. I know we had you on last time, but anything else, that would be fantastic.
Go ahead, Mary Beth, you can go first.
Oh, thanks. I'm Mary Beth Fisher. I am the program coordinator for the Cancer Services Program of Warren, Washington, and Hamilton counties. We are a grant-funded program that's held by the Glens Falls Hospital. Glens Falls Hospital has held this grant for 30 plus years. We are able to give individuals who are uninsured or underinsured between the ages of 40 and 64 for women and 45 to 64 for men, screenings, colorectal, cervical, and breast screenings. We're also able to help them if they need further diagnostic testing done. And if they were to be diagnosed with cancer, we are able to get them into the Medicaid Cancer Treatment Program, which is a Medicaid insurance that's unique to our program that basically covers soup to nuts as far as any coverage you need for treatment while you are going through treatment of cancer. So any doctor, dental, eye appointments, the MCTP program is able to cover you and keep you so that's the least of your worries when you're going through your treatment, is that you know that you are covered with insurance and nothing will come out of pocket, and you can concentrate on getting yourself well. So that's who I am.
All right, I'm Vicki Yatta. I am the Oncology Education and Support Services Manager at the C.R. Wood Cancer Center at Glens Falls Hospital. I am an oncology nurse, been working in oncology for the last 18 years. So my role is kind of making sure patients who are diagnosed with a cancer have all of the support that they need, remove any barriers to care, help do some community education to make sure people are getting their screenings, because as you'll hear later on, the importance of screening and early detection is the key to getting through cancer diagnosis easily and quickly.
Absolutely. And like I said, it's a pleasure to have you guys here. Obviously, the Cancer Services Program and the Charles R. Wood Cancer Center is one of the best. It's been nationally accredited by the American College of Surgeons as a community hospital comprehensive cancer program. That's the highest designation that somebody can get outside of an academic environment. And on top of that, the Breast Center has been designated as a Breast Imaging Center of Excellence by the American College of Radiology. Again, two very, very high distinctions to have. And it's awesome that you guys are able to take time out of your day to come and talk to us about it. As we're kind of talking about cervical cancer, it's one cancer that I feel kind of goes underneath the radar. There's a lot of different cancers that everybody knows about. Everybody knows about breast cancer. Everybody knows about, leukemia, a lot of different things. There's a lot of different cancers, but cervical cancer kind of flies underneath the radar. And, as we kind of were hinting towards, there's a lot of reasons for that. We don't have a lot of statistics on cancers for us that were reported to from the state to the county to us. But Vicki, I know that we were talking beforehand. You guys actually had a few statistics in there, and they're actually kind of surprising.
Well, I've been doing this a while, and we've actually seen a decline in the number of cervical cancer cases. And the latest information I have is in 2020, we actually only saw 5 diagnoses of cervical cancer here at the Cancer Center. And I think that's mostly in part to that HPV vaccine that we'll jump into a little later.
Absolutely. And not only is it the HPV vaccine, but a lot more people are getting tested. We ranked the New York State itself ranked 6th in the nation overall for the amount of cancer screenings that were done in 2020. There was, I believe we covered 80.3% of the population that could be eligible for a cervical cancer screening received in a cervical cervical cancer screening. You know, obviously that's very, very, it's amazing to have, you know, to be ranked 6th in the nation. There's a lot of other states. There's 50 states that we're, you know, competing against to make sure that we have the healthiest community possible. And like you said, with only 5 and we're seeing that decline, that's really, really awesome. And as we were kind of talking about, there's the HPV vaccine. And, you know, vaccine is kind of a tricky topic, especially as of now. But the HPV vaccine has shown multiple times in multiple studies across nations, across, you know, it's a whole global study, and a lot of them, they have really, really amazing results. You know, a few of these modeling studies in low income and middle income countries, they have the possibility to completely eradicate cervical cancer in their community by the end of the century, which it may seem like that's a long time. That is not at all. I mean, come on, we locked down for 2 years and we still have COVID, you know, so there's a lot of different things out there, and to completely eradicate a cancer is really, really awesome. And if you guys wouldn't mind, you know, we're on the topic of the HPV vaccine. What is the HPV vaccine? How do I get it? And when should I get it?
Sure. So the HPV vaccine, that's known as Gardasil, there's other names for it. So it's a vaccine that stops your body from getting that human papilloma virus. Now that is a virus that's sexually transmitted. It's only can be transmitted from body contact to body contact. So the best time to start that HPV vaccine is before people are sexually active. So, you know, the guidelines state you should start at ages 11 to 12 for both females and males, because HPV related cancers, not just cervical cancer, but there's, you know, head and neck cancers is what I see a lot of that are HPV virus related, but anal cancers, penile cancers, there's, you know, 3 or 4 other different cancers that are HPV related. But so they should start at age 11 to 12. With that, they're going to need 2 shots that are given 6 to 12 months apart. If anybody over the age of 15 needs the vaccine, you can, ages 15 to 26, you can still get the vaccine, but you are going to need 3 different shots. And anyone from 27 to 45 can still get the vaccine if they're considered high risk. So they just need to talk to their doctor, but anyone from ages 11 to 45 can get the vaccine if they want it.
Absolutely. And like we said, it's a vaccine that can prevent a cancer. That's not, you know, that's something that you really, really don't hear an awful lot about, but it's something that you definitely need to hear about. I mean, you know, for somebody like us, we hear about it all the time, but this is our job. This is what we do. This is what we study. This is, you know, what we read about. But for the general public, maybe that's not something they always hear about. They hear the HPV vaccine and they say, all right, it only takes care of HPV. But there's a lot of different cancers that are related to that. So obviously preventing an HPV infection and preventing a cancer, you can't put a price on that. That is really, really awesome. And, you know, as we're kind of talking about it, we're seeing that decline in cervical cancer. Do you feel that there is a specific reason as to why that is? Is that there's more education about it? Is it the HPV vaccines that are being more widespread? You know, are people getting more screenings done? What have you guys been seeing?
I think everything you just said is a contributing factor. I mean, the HPV vaccine has been out since right around 2005, 2006. So now is when we're seeing those people who would normally get HPV related cancers popping up. So that and early screening and early detection. So, you know, if they get their screenings and they're anything abnormal, their doctors are removing those abnormal cells so that they don't grow into cancer. Or if they're finding, you know, HPV, you know, they can get screened more frequently to make sure that they don't have any issues. So I think screening is a huge factor in decreasing that. The amount of people who get HPV vaccines is a huge factor in that. One of the studies that I just read from the CDC, that since 2006, there was an 88% decrease in the number of teen girls who had HPV related cancers or genital warts, and an 81% decrease in young adult women with cervical cancer. So it's a huge number.
Yeah, absolutely. And I mean, that's a massive step forward in, public health and general health. And, it's something that doesn't get as much spotlight as definitely needs to be. And, Mary Beth, as you were kind of talking about being eligible for these screenings, for somebody who's underinsured or uninsured, how can they navigate through the cancer services program to get the screenings that they need? What are kind of the requirements and how does somebody get started?
All they need to do is a phone call, 518-926-6570. Calls our office. It's a 10-minute at most conversation. We fill out a little form. We talk to them about the screening, the importances of getting all of their screenings, depending on the ages that they are. And then people are more open to that when they know that they're covered. They also are more open to it when they know that they've got they've got a partner in this that is going to help them along the way. A lot of women are afraid of pap smears. It's been a taboo type of subject, and for people that are our age, my age, I should say, old. I mean, HPV tests or shots weren't available, so you're seeing more prevalent with people our age having to get treated for different types of pap smear results, HPV results. But the thing that's great about it is if they follow through and get it treated, it's gone. It's not something that's going to come back. It may come back, it can be treated, but it's a treatable cancer. It's a preventable cancer when you get your HPV shot and you also go for your screenings. It used to be a yearly thing. Now we do it, if you're completely HPV free and you've had a good pap smear, you can go 5 years until your next pap. If they want to follow you, it's getting the people to understand that they're following you for a reason. There's a spot that looks a little funky. They want to make sure they take care of it before it gets into anything that could be cancerous. So the importance of not just getting your pap smear once when your son was born 28 years ago. That's great. Let's do it now because it's important. It can help you prevent from getting this cancer that nobody wants cancer.
No,
As
absolutely.
Vicky says time and time again, cancer sucks. If you can actively do something that's going to prevent you from having this, do it.
Yeah, absolutely. And as you said, cervical cancer is an easily preventable, easily treatable cancer. And that's something that you don't often hear those words with cancer. You don't hear treatable, you don't hear preventable, but that's what cervical cancer is. It's a very treatable and very preventable disease that if you get the HPV vaccine, there are studies that show that you have more than an 80% decreased risk in getting cervical cancer. And I mean, that's incredible. I mean, if you could reduce your risk of a heart attack by 80% by getting a shot, I think there'd be lines out the door, so.
Most definitely. I think
Absolutely.
the education that New York State has done with, their public health and the announcements on TV and the commercials on TV about the HPV vaccine for kids has helped a lot with educating people into why they're getting the HPV shot.
Absolutely.
It's not just something for right at this moment, it's for something down the line. It's, you don't want your kids to have to go through this. So if you can prevent it, give them the shot.
Absolutely. And, as we're kind of talking about the pap smears and we're talking about the screenings, Vicky, if you could kind of explain, how do I, what's the process of the screening? How, obviously probably not me, but, for somebody else, that may be listening in on it, it can be a scary thing to go in and, have those cancer screenings because there is the possibility of what if I get the answer that I don't want to hear. But how do you kind of get people to get out of that mindset and just say, I'm going to do something that is going to help me further down the line. I may get an answer that I don't like, but it's better to get that answer that I don't like now rather than, further down the line when I can't treat it or, it's way more detectable.
Right. So, let me bring it back a little bit and just make sure that people understand what the cervical cancer screening guidelines are. So really people starting at age 21, 21 through 29, they should have pap smears every 3 years. Okay. And then from 30 to 65, like Mary Beth said, if you do an HPV test plus a pap smear, as long as those are fine, you can go every 5 years. So it's really not that often that you have to have this screening done. So what I say to a lot of people, yeah, it's uncomfortable. Nobody likes to have that done. Anybody with a cervix has to go get it done. But for a momentary discomfort, it's going to prevent you from having to come in to get treatment. So it lasts only about, I don't know, Mary Beth, 15, 20 minutes actually to do the whole test.
Not even.
Not even. I mean, it's really, it's uncomfortable, but it's not unbearable, right? So, and if they find something early, then you go back for another uncomfortable procedure. But you know what? It's better than having to come in to go through chemotherapy, which, you think of chemotherapy, you think of nausea, vomiting, hair loss, all the things that go along with chemotherapy. But one of the biggest things with cervical cancer treatment is radiation therapy. So radiation therapy causes all kinds of issues because it kills bad cells, but they do it from the outside, they do it from the inside. So there's a lot of scar tissue. It's Monday through Friday. It's 6 weeks of treatment. So that's a little bit more inconvenient than just doing a pap smear every 3 to 5 years.
Absolutely. And
I like to, can I add to is ladies, if they're finding that their periods are changing, they're getting pain, don't put it off. A lot of people will go, okay, yeah, I'll take care of this and I'm too busy. No, take care of it now when it's something that can be treated, and not wait 6 months to a year and say this has been going on for over a year. Be aware of what your body's telling you. Obviously something's wrong, so go get checked. And like Vicki said, a lot of patients don't understand too is that your HPV test is done while you're doing the pap test. It's all the same. So a lot of people are like, well, what do I have to do? Go get blood work? No, it's all done at the same time. It's not an extra time. It's all done at the same time. So, you're getting your co-test done basically at the same time. There's very few, I don't believe, that don't do an HPV test along with the pap. So it should be an automatic thing when you're going to the gynecologist, but definitely if you're feeling any sort of symptoms, you should call your doctor.
Yeah. And right on top of that one, Mary Beth, and even though you had a normal pap smear 1 year, don't wait the 5 years. If you do have symptoms, you are your own best advocate. If you're having something going on, don't say, well, I just had a pap smear 3 years ago and it was fine. I think I'll wait the 2 years. Go see your doctor, talk to them about what's going on. They are your best resource to get you into whatever services you need.
Absolutely. And, as you guys were kind of talking about, listen to your body. Nobody knows your body better than you. You deal with it every single day. You know what feels normal, what doesn't feel normal. If something isn't feeling normal, go and get it checked out. You can prevent, as we said, kind of lifelong illnesses just through a simple 15, 20-minute procedure. And, as we're kind of, talking about the pap smears, for somebody like me, at my age, and when I'm talking to people about, I'm around the 20-year-old range where now is the time that people are starting to get pap smears. And from what I've heard, there's a little bit of hesitancy when it comes to getting the pap smears. And, as you guys pointed out, that it's uncomfortable, but it's not unbearable. And if you could kind of like talk about why would I get the pap smear done? It seems like it's 15 to 20 minutes, but it's uncomfortable. I'm not really liking it. I don't really want to hear the answer. How do you kind of tell somebody you're gonna want to do this? How do you get somebody to understand that this is a beneficial thing?
I think one of the biggest things is when you tell people that you're getting screened for something that's preventable, that you can actually take care of and avoid getting cancer by doing this, that's kind of a huge selling point. And, we say 15, 20 minutes. The PAP itself, the whole appointment might be 15 and 20 minutes. A PAP itself is maybe about a minute. if that 30 seconds, it's how fast your doctor's talking and, but, it truly is, it's a short, quick little swab that they're doing and you're done. And it's just to have that done and know that you're preventing something, and being aware and taking care of, if there is something wrong, don't avoid it. Just go in and yes, it's scary, but you can do it. And you're going to avoid a lot worse going down the road if you don't take care of it.
Yeah, and Drew, to answer your question, we've been throwing this word preventative around, and people are like, well, how does a screening actually prevent cancer? And the reason that happens is if your doctor sees something abnormal on there, like a polyp or abnormal cells from the pap smear, they can go in and basically cut it out, burn it off, cut it out. So that abnormal cell, that polyp can't grow into a cancer. So that's how these screenings make cervical cancer preventable. It's a preventable screening to remove any cells that could potentially turn into cancer.
Mm-hmm. And if you're ever going to catch a cancer, you hope to catch the cancer early. And that's the whole point of the screening, is to catch anything, if anything, early enough. So then it's, like we said, easily treatable at that early stage. Once it's at the early stage, it's way more easier to treat than when it starts spreading to other parts of the body. And, you start developing into different stages. And that's when things can get a little messy. And that's when things are not exactly fun. But, like you said, treating it early, making sure we see them early, preventing those things, that's obviously a very, very huge thing. And, for somebody that may be listening to this, they may be thinking, oh, I wish I could get it. I need to get an HPV vaccine. And so for the HPV vaccine, if you wouldn't mind just kind of going over, I know we kind of discussed it in the beginning, but I really want to kind of hammer it. How often, oh my goodness, not even how often, when should I be getting the HPV vaccine? And if I'm a parent with a child that may be getting to that age, where do I go? What's the process?
So I'll tell you, for parents with children that start at age 11, talk to their pediatrician. Pediatricians around here are fabulous about talking to patients, parents about it. And I've seen a huge swing from when, my kids were one of the first kids that got it. I didn't even give them the option. I just said, yep, do it. Right. Because, I've been on oncology forever, it seems like. Mm-hmm. But I'm finding that kids nowadays are very well educated, and right up to age 20, that kind of thing, or more. I mean, the information overload that we get. So I think the providers are doing a really good job, not only educating the parent, but they're educating the child as well, or the young adult. So pediatricians are great. They can give the vaccine right there. A young adult, if you have a healthcare provider, you can get it right there. I know they're working on some pharmacies to be able to give the HPV vaccine, but I don't think that that's fully realized in this area. We're seeing it in New York City. Mm-hmm. But definitely talk to your healthcare provider, because they can give the vaccines at any time. Like I said, up to age 45. Yeah,
absolutely. And, it's going to be, a nitpicky thing, but as public health, individuals, we always try to improve. We always try to get to the 100% screening process. Granted, 80.3% of an entire state, let alone, a city, putting 80% of a city, now you bring it out to an entire state, including New York City. 80% that could receive a cervical cancer screening did receive a cervical cancer screening. But however, I like to, be the devil's advocate. What is preventing us from getting to the 100%? Is it, like we said, maybe the pap smear is uncomfortable. Maybe it's a policy standpoint. It's not as accessible as it needs to be. Or maybe it's just a lack of education. I had no idea that an HPV vaccine could prevent a cervical cancer. I had no idea, not only in cervical cancer, but like you said earlier, many different types of cancers. So, that's something that I didn't necessarily know about until I was working in here and kind of reading more about it. But what is preventing from getting to the 100% screening rate?
I think lack of education is the biggest one. You know, the fear of the unknown, or, oh, I heard this, I heard this, I heard this, but not actually doing the research and getting what's true and real. So, you know, if anybody wants somebody to come talk to them or their group or anything about the HPV vaccine through the Health Promotion Center at Glens Falls Hospital, there's a grant funded program that's called Cancer Prevention in Action. So they have a community educator that will come out and talk about the HPV vaccine. So if anybody wants to, just, you know, you can give me a call, 518-926-6639, and I can get you set up with that program. But I think the fear of the unknown is one of the biggest issues that we see. I mean, I'm sure you do. The lack of education is a huge thing.
Absolutely. And, you know, as we kind of talk about the lack of education, that's not saying that people aren't educated. People may be educated, but they're not understanding 100% of what it is. You know, obviously, I spend most of my time, I'm reading studies on new public health efforts across the world. And, you know, I myself learned an awful lot from that, but I'm a giant nerd. I know not a lot of people are reading these vaccine studies. I know not a lot of people are reading these modeling studies, and let alone when you do read them, they're not exactly fun reads. They're not real page turners. So, you know, we see those things and we know what they can do, but to the general public, it may not be something that's on the top of their list. This may not be something that's on their radar. But as we kind of talked about, HPV vaccines, not only do they prevent cervical cancer, but they can prevent many other different types of cancers. And Mary Beth, if you wouldn't mind kind of explaining for the Cancer Services Program, I know there's a bunch of different support groups that you guys offer, let alone, you know, not only in person, but also virtually. And if you could kind of talk about, you know, what's the purpose of a support group? You know, so if I receive a cancer diagnosis, what can a support group kind of do for me?
That's more Vicky's
All right.
area of expertise. So I'm gonna, you know, I can get you a free screening. I can get you into a pap smear. Vicky can get you the support groups that you need.
Absolutely. So Vicky, if you wouldn't mind kind of explaining.
Sure. So I know support groups are not for everybody, and I get that, but you know, at a support group, you're with like-minded individuals. So if you have a cancer diagnosis, you may have great community support with friends and family, but they don't have a cancer diagnosis, so they don't really understand what you're going through. So the greatest part about a support group is you're with other people with like diagnoses who have cancer diagnosis that are facing the same fears, concerns, side effects, issues, emotions, the roller coaster, all that kind of stuff. So a support group can kind of help you be with other peers to say, hey, I'm feeling this. Are you feeling that too? So it brings some normalcy into that cancer diagnosis. It makes you feel so you're not alone, right? So that was one of the great things, sharing resources, connecting with other people. Right now, we have a Rays of Hope support group is for all gynecologically based cancers. So your ovarians, your cervicals, any of the female lower parts, they're more than welcome. And it is a virtual program. So you can just check out our website. It does have all of our support groups listed on it.
Absolutely. And like we said, you know, obviously going to you guys should be one of the first steps. You guys have, you know, many different distinctions on how robust that your program really is. You know, obviously the Cancer Services Program, I didn't necessarily know that was a thing until I was working here. And once I heard about it, I was like, oh, we got to get this out there. You know, if I'm not knowing about it, I know a lot of other people that are probably not going to be knowing about it. So, I mean, like I said, you guys offer the free cancer screenings for those that are underinsured or uninsured. You guys have wonderful staff. Every time I've gone in there, I felt like I was like a part of a family or something like that. And you know, you guys have been absolutely amazing, not only for our community, but also for us as an organization. You know, we can really rely on you guys to kind of help us out with these initiatives and these different things. And are there any other, you know, things that you guys would like to address? Maybe it's from a policy standpoint where, you know, you're hoping for a little bit more education, or maybe you're, you know, looking for more educational initiatives. And, you know, maybe you guys have an event coming up in March 24th or 25th, you know, at the Adirondack Thunder game.
Oh, look at that. You jumped right into that. What a nice segue. So yeah, so we're really excited this year because the Adirondack Thunder hosts a 2-night event. They call it Stick It to Cancer. It's on March 24th and 25th. So at this event on Friday night, you know, they're going to be wearing these special jerseys, and at the end of the game, you can go out and, you know, spend $10 and you can paint the ice. And then Saturday they play on the ice. But one of the greatest things that we're doing this year at Stick It to Cancer is we have some local dentists. We've teamed up with the New York State Dental Association. We're actually going to be doing oral cancer screenings both night, free to anybody who comes to the event. So, and anybody who gets oral cancer screened that night will get their name put in a drawing for a signed hockey stick, plus some all great oral care stuff, some free toothbrushes, you know, whatever. We got a little swag to hand out. And it's a great
Absolutely.
fundraiser. It's a great fundraiser for our cancer program because, you know, I'll tell you, a lot of our head and neck cancer patients, which are HPV related, they need to see a dentist. And a lot of times they need dental cleanings, they need dental extractions. So we use the monies that are raised from this event to help pay those dental fees for those patients so they can get through treatment quickly and efficiently.
Absolutely. And, you know, before we kind of wrap up our discussion here, I really kind of wanted to highlight the resources that you guys do have available for not only just for community members, but maybe somebody that's going through a cancer diagnosis. We talked about the free cancer screenings for the uninsured and the underinsured. We talked about the oh goodness. Yeah, we talked about all
Support
sorts of
group.
different things. Yeah, the
Yeah.
support groups. Thank you very much. I don't know why I blanked on that one. But you guys have even more. As I kind of like look through your guys' website, I always like to check up and see if you guys have anything new going on. But as we kind of go through that list of the resources that you guys have just seems to keep getting longer and longer and longer. And very well deserved, obviously. So if you guys wouldn't mind kind of, what can you provide not only for, a community member like myself, but for maybe someone that's going through the cancer diagnosis, what do they have in the cancer services program and in the cancer center from you guys that can really kind of help them out?
Well, I'm just going to put in a real quick plug. If you don't have insurance and you need to get screened, colorectal, cervical, breast, give us a call, 518-926-6570. We can get you hooked up with the program, get you hooked up with a primary care provider. We can get you re-engaged with the healthcare system and get you healthy. So definitely give us a call.
Absolutely.
And then if they, go through that, they get screened and they get a cancer diagnosis, then they come down to us. And I have, 3 nurse navigators that meet with patients that come in to kind of help with any resources that they need. We have a financial navigator that can help with any copays or out-of-pocket costs. We have a health psychologist and a mental health counselor that can work with the patient with their diagnosis or their caregiver. We have a massage and Reiki services right here within our cancer center. We have a boutique that offers free wigs, hats, and head coverings for our patients. We have an oncology dietitian that can talk about nutritional services. We have clinical trials right here at the cancer center. We have a genetics program. Pretty much whatever the patients need, we've got you covered here at the C.R. Wood Cancer Center.
Absolutely love to hear it. Obviously, as we, I cannot speak enough about you guys. I mean, the stuff that you guys do on a daily basis, it's incredible. For somebody like me, I'm kind of like, I'm really surprised, especially after, kind of working here. I'm realizing, wow, there's a lot more to the community than I realized. There's a lot more resources out there than I realized. And I think that's the most important piece that we really want to get out there is that, it may seem like, I know, especially for me, it may seem like, oh, I got to go down to Albany and I got to do this, or, I got to go down into Massachusetts and I got to do something else. And reality, a lot of the resources that you have are in your own backyard. They're in your local hospital, and it's a very, very, very robust program. Obviously, you guys are doing so much for our community. And as we wrap up our discussion with cervical cancer, is there anything that you guys would like to point out towards the end? Anything that we didn't get to address that you guys would like to address?
I think we've covered just about everything, Drew.
Absolutely. You know, that's always a good thing. And you know, Mary Beth, I'll give you one last one here. If somebody did want to get to, if somebody was uninsured or underinsured and they did want to get to the cancer center, you know, get their cervical or breast or cancer screenings, what number do they contact you at?
518-926-6570. Give us a call.
Alrighty, there we go. Absolutely love to hear it. Thank you guys so much for coming on. I've been your host, Drew Crawford, public health educator here at Warren County Public Health. Thank you so much for joining us.